Hello all, myself Murshida Yasmin, Assistant Professor from SNS College of Physiotherapy. Today's topic is about joints of the human body and its classification, which is a fundamental topic in the subject anatomy. Introduction about the joints. Arthrology refers to study of joints. Kinesiology refers to study of musculoskeletal movements. Joints are the regions of skeleton where two or more bones meet and articulate together. It is supported by variety of soft tissue structures related to the joints. The primary function of the joint is to facilitate growth or to transmit force between one bone to another, thereby enabling movement or weight to be transferred from one bone to another. Joint and its classification. The classification is based on functional and structural property of the joints. The functional classification is based on the freedom of the movement available in the joint. It is further classified into diarthrosis, freely movable joint, amphiarthrosis, slightly movable joint, synarthrosis, immovable joint. The structural classification is based on how the adjacent bones are joined together. It is further divided into fibrous joint, cartilaginous joint, and synovial joint. This picture shows the example of fibrous joint, which is a skull, which is immovable joint, and the cartilaginous joint is between the vertebra, is slightly movable joint, and synovial joint is a knee joint, which is a full movable joint. Fibrous joints are otherwise called as synarthrosis. Bones forming the joint are united by fibrous connective tissue. That is why it is called as fibrous joint. They are either immovable or permit only slight degree of movement in the joint. It is further classified into sutures, gomphoses, and syndesmosis. Sutures of the fibrous joint are separated by layer of membrane derived connective tissue. This connective tissue decreases with the age so that the osteogenic surface become opposed. The picture shows the sutures of the skull bone as a classic example for the sutures of the fibrous joint. Syndesmosis of the fibrous joint are formed by an interosseous membrane between two bones, which allows some movement in between two bones. The interosseous membranes between the radius and ulna and between the tibia and fibula serves the classic example of the syndesmosis of fibrous joint. Gomphoses of the fibrous joint acts like a peg in the hole structure. The example for the gomphoses is a tooth into its socket. It is held by a fibrous periodontal ligament. That collagen fiber attach the tooth to the jawbone. Some movement is happening in the gomphoses while chewing. That is a classic example of the gomphoses of the fibrous joint. The next classification is a cartilaginous joint. The cartilaginous joints are held together by cartilage. There is an absence of synovial cavity in the cartilaginous joint. The types of the cartilaginous joint are synchondrosis and symphysis. Synchondrosis of cartilaginous joints are joined by hyaline cartilage. Example, first rib attachment to the sternum. Epiphyseal plate in children binds epiphysis and diaphysis. And synchondrosis is an immovable joint. Symphysis is defined by presence of intervening pad or a disc-like fibrocartilage that is present in between two bones. For example, pubic symphysis and intervertebral disc that presents between two body of the vertebrae. These are the classic example for symphysis of the cartilaginous joint. This joint, there will be a slight movement will be produced in that joint. Next is classification is synovial joint, which is called as diarthrosis joint. This diarthrosis joint permits free movement in all the direction. Presence of synovial cavity calls the synovial joint. Ends of articulating bone are covered by articular cartilage. Joint is surrounded by fibrous capsule. The fibrous capsule is lined by synovial membrane. Most of the joints of the body are the synovial joints. This is the structure of the synovial joint. In this, you can see the end of the two bone and there is a gap in between that is called a synovial cavity which is lined by synovial membrane. The joint cavity contains a synovial fluid and the synovial membrane lines the articular cartilage of the two bones and this is the classic structure of the synovial joint. Classification of the synovial joint are based on the shape of articulating surface and according to the plane or the degree of the movement available and according to the number of the articulating bones. According to the shape of the articulating surface, it is divided into plane joint, hinge joint, pivot joint, condyloid joint, ellipsoid joint, saddle shaped joint, ball and socket joint. This picture shows the example for all types of this articular surface type of joints. Pivot joint example is between C1 and C2 vertebra in the neck region and the hinge joint example is elbow. Saddle joint is between trapezium and carpal bone and the first metacarpal bone of the hand. And the plane joint is between the tarsal bone. Condyloid joint is between the radius and carpal bones of the wrist. Ball and socket joint is by the hip joint and also by the shoulder joint. According to the plane and the degree of the movement, the joint is classified as uniaxial, biaxial and multiaxial. Uniaxial joints moves in only one axis. Example, hinge joint and pivot joint. Biaxial joints moves along two axes. Example, condylar joint, ellipsoid joint and saddle joint. Multiaxial joint moves along many axes. Example, ball and socket joint. It happens in three planes or axes, so all kind of movement are possible in the multiaxial joint. The picture shows the example of uniaxial joint and the biaxial joint and the multiaxial joint. According to the number of articulating bones, the joints are classified into simple joint, compound joint and complex joint. Simple joint, only two bones forms the joint. Example, joints of the finger and the toes. Compound joint, more than two bones unite together and articulate together and forms the joint. Example, tibia, fibula, talus in the ankle joint. Complex joint, the joint cavity is divided into two compartments. Example, knee joint. So that is the complex joint. This picture shows the simple synovial joint. Only two bones are used in the simple joint and this can be an example for the finger and the toes. And the compound joint, two or more bones are formed in the compound joint. And the complex joint, the joint cavity is separated into two. One cavity is located here, the other one is located here. Example is the knee joint. So thank you.